New Zealanders suffer 8,000 strokes a year, and now there's groundbreaking medical technology to help treat them. The treatment, called endovascular clot retrieval, can be the difference between lifelong disability and walking out of the hospital like nothing's happened. Paul Hobbs reports.
Two very different people with one big reason to smile.
Yeah, I was just surprised that I'm back to normal.
Just yesterday morning, Langi Mausia suffered a massive stroke trying to open the garage door.
I can't even grab the handle and twist it.
His left side was paralysed. Seconds later, he couldn't talk. 2 hours on, he was in hospital. Doctors performing an endovascular clot retrieval.
We knew that the strokes were caused by a blocked artery, and it's not rocket science. If you open up the artery, you get blood back to the brain and it doesn't die.
It works like this. A catheter is fed up through the femoral artery in the groin all the way up into the brain, into the clot. The retrieval device is fed through. When released, it traps the clot, taking it back out the way it came.
This is a game changer.
It's all about time. The quicker you realise you're having a stroke and can get to hospital, the better the odds. When a clot blocks blood flow to the brain, other vessels can act as a short-term backup, but doctors only have a brief window in which to act, between minutes and a couple of hours, before the brain starts dying. 1 in 5 people who undergo this groundbreaking procedure return home like nothing's happened. Katrina Wheatley had her stroke in October.
I just sort of did nothing much for the first week. By that time, my husband said, OK, you can cook tea from now on.
So far, the procedure is limited to the main centres, but plans are in place to reach more of the country. Langi's just grateful he can go home to be husband and father to his 4 children. Paul Hobbs, One News.